So my name is Sarah Reyes. I am in support of this bill. I am a policy analyst for the Texas Center for Justice and Equity. We are a nonprofit organization that engages in both state and local policy around Texas that advances decarceration and promotes overall community well-being. I think this is a great bill, and I thank the representative for bringing this forth because I believe these strips can and will save lives. Fentanyl test strips are a low-cost method of helping prevent drug overdoses and reducing harm. They provide people who use drugs and communities with important information about fentanyl and their drug supply so they can make an informed decision about their usage. Studies have shown that when people receive a positive result, they are more likely to change their mind about their usage decision. Decriminalizing fentanyl testing strips is without a step in the right direction in the fight against the overdose crisis we are seeing today. But I would like to take this opportunity to say that I also believe that we can do more than just decriminalize fentanyl strips. In order to reduce overdoses, we need a comprehensive strategy. I have a couple recommendations on how we can create an even safer Texas. One, my first recommendation would be to have added language in this bill that includes and other adulterants. An example is Senator West's SB 868. So it can be applied to testing substances beyond fentanyl. Overdoses involving other substances are not detectable with fentanyl strips, and Texas lawmakers should permit testing for any substance that carries serious risk. Two, I would urge this committee and this legislature to take it a step further and decriminalize drug paraphernalia as a whole and other harm reduction efforts. As I said before, it's great to see fentanyl testing strips be decriminalized, but they are not the only tool that would keep communities healthy and safe. Drug testing is only part of the solution. And lastly, education. This is more of a general recommendation. There's a need to understand substance use and overdose prevention in Texas. So anything we can do to promote that is essential, as education is power. I've heard many stories of people overdosing, especially young people, and how it may have been, a one-time instance because they didn't know or think that it would be deadly. It's tragic, and educating them and the community is another tool we can give in order to prevent and mitigate this harm. I want to end my testimony by reiterating that this is a helpful bill and that I hope that together we can continue having conversations around expanding harm reduction efforts and keeping Texans safe. Thank you for your time, and I'm open for any questions the committee may have.
Questions, members? Thank you.
Thank you, guys. And so I'm hoping to clear up some stuff about, hearing a lot of things about how this bill may encourage usage, when in fact it's really just about mitigating harm. And also these syringe programs don't only just give syringes. Within the bill, it talks about giving education, like our first testimony talked about prevention. A lot of syringe programs also do things like connect people to housing and food, and really addressing those root causes. And so right now, like I said, this is about mitigating harm now and in the future. Right now, there are people using substances in an unsafe way. And these programs will help bring out of hiding people who are scared of being incarcerated or judgment, and in turn allow people like harm reductionists to reach more people and really help combat addiction. We can't force people to get help if they aren't ready, so we are hoping to mitigate that harm and hoping to destigmatize this issue. Because the way we are addressing substance use right now is through incarceration, which isn't working. When an individual gets arrested for substance use, they go into jail or prison, having received no actual support or resources. And once out, they often come out to the same conditions they were once put in there for. People are thrown in and out of the system without any tools they need to survive or stay safe. How we are addressing drug use right now isn't working, whereas harm reduction programs and practices aim to mitigate harmful drug use, social and legal impacts associated with drug use and drug policies. And I know we've heard Representative, I don't know how I say your last name, so, but talking about programs with teeth, I would love to hear, more of what you expect in that, just because we cannot force individuals into treatment. People have to be willing to go, because if we continue to force people, like we see in drug courts, mandating people to go to treatment, we're setting them up to fail. And so I hope that, we keep in mind that we're here to really help people, keep people alive. We're seeking non-judgmental support, and that's what these syringe programs are about. They are proven and effective community-based programs. There's so much data about them. They bridge many different types of supports, as I said before, and they really just address the root problem that we are seeing today. So